So we welcome all of you to this session, and Dr. Geeta, heartiest welcome to you as well.
Thank you, Dr. Vasudha.
Yeah, we are very happy to see you, and I think discussion with you is going to be very informative, I'm sure. And then I also am looking forward to the interaction with you, and it's been a very long time that we have also discussed, and that has, I think, been earlier a few years ago. So really glad to have had you today, and thank you very much for your time. So at the outset, I would like to introduce Dr. Geeta to all of you. So Dr. Geeta Appachu is a psychologist, a very senior psychologist, and she is heading Parental, which is her organization. So she's a clinical psychologist responsible for counseling, diagnosis, and psychological intervention. And what is very highlighted is her educational qualification, with her bachelor degree in psychology in honors and her master's in psychology with specialization in clinical psychology, and a PhD in psychology with the area of holistic health psychology, which is very close to what Vivekananda Health offers. And her postdoctoral research is in collaboration with NTNU, which is the Norwegian University of Science and Technology, Norway. So this itself tells us the large experience which Dr. Geeta has, and we are very sure that all of us are going to learn a lot of things from her, a lot of information which we will be using it for ourselves and for the society needs. And this is how we have to reach out and understand more about this subject which we are discussing today. And it's specifically talking about coping in teenagers. So, and this is specifically addressing the teenagers, because we see that this particular season, I would say, is largely focused on them between say 12 to 17, 18 years. They undergo a lot of transitions in their student life and their personal life as well, which is what is very specifically being addressed today. And Dr. Geeta definitely is an expert, because she's developed and applied a lot of measures to assess both stress experienced by individual and the internal and external resources available to cope with stress. This is what she specifically works on, and she's an accomplished teaching faculty and dedicated scholar with more than 15 years of qualitative experience in mentoring and teaching psychology to graduate and postgraduate students. She's an effective communicator. I've seen that very well, and with excellent relationship management skills, and she has honed analytical problem solving and organizational abilities. Dr. Geeta also conducts a lot of programs, training programs at a personal level, interpersonal, for improving interpersonal competence, leadership skills, stress management, and other areas of human dynamics. So she has been providing counseling and psychological consultancy to people in need. And we are also glad that we have been working with Dr. Geeta from Vivekananda Health Global. So Vivekananda Health Global is a chain of integrative medicine centers where we exclusively work on integrating Ayurveda, yoga, and naturopathy. And this is how we integrate with different experts and bring their expertise for better patient healing. And we all therefore want to work towards personalized and individual care for better health to people who reach out to us. So with very short introduction of Dr. Geeta and of the program, we would now initiate certain questions which we have already received, and we will get into a discussion mode. So the whole next about 50-55 minutes are going to be so that we'll first have a short, brief talk by Dr. Geeta, and then followed by that, I have a set of questions for her. We'll also have an interaction. After that, we'll also open the forum to questions from all of you, who I'm sure are very eager to ask your set of questions. You can please type your questions also in the chat box, maybe after some time, not now. We'll take up the questions and also try to address all your questions as much as we can. So addressing this topic today, therefore, is stress, its impact and coping in parents and their teenagers. So Dr. Geeta, over to you. Once again, welcome you to this Ask Me Anything session from Vivekananda Health Group.
Thank you, Dr. Vasudha. It's always so nice meeting you, be it in person or at least over the screen. Dr. Vasudha, all participants probably know you being, an Ayurveda expert who is basically looking at an holistic way, bringing in yoga intervention also into your treatment modalities. When we start talking about mental wellness, thanks to the pandemic, everybody was so sad when the pandemic came, thanks to the lockdown, which made us realize so many things. But I will say one thing, thanks to the pandemic, I'm sure, Doctor, you will realize that hygiene became a very easy introduction to everyone. Even a little kid wanted to be conscious about hygiene. So most of us learned, what is hygiene. And during this time, I was able to introduce both mental hygiene along with this physical hygiene, which a lot of people became so paranoid about. They thought, we need to wash, we need to sanitize. And at that time, there was so much of a neglect that happened in the way of relationship, maybe in the way of emotional, confusions, maybe a lot of things, a lot of change happened. Now, when we talk about what happened to teenagers, this is something that has happened probably globally, because seeing the clients from across the globe, one thing is that this whole aspect of socializing became very, very different. It was just probably through a chat or sitting at home and trying to meet people across the corners. Teenage, when we talk about this, I'm sure we will not have a teenager who will probably join this session, but I have seen something wonderful happening in the way of Swapreran or a mental wellness clinic. I've seen that clients who are teenagers mention at home that I want to go visit a psychologist. So does that mean that parents are not able to understand or listen? No, well, that's not at all the fact. But then I have seen that this kind of knowledge is something that a teenager also wants to go sit down and take professional support and help. How many of us believe that in spite of me being a good math teacher or a good Kannada teacher or a good Hindi teacher, at least I can teach my child? We believe that, no, let this child go and face a teacher, a tutor, and get mentored better, especially now when it is the 10th standard or 11th or 12th standard. This time, it is also important for us to realize that this is just what happens in a psychological counseling session. Most parents have also said one thing: when I say something, why is it that my child is not wanting to listen, not wanting to understand or obey? But how come when we take him or her to a professional, what is his difference? Why is it that now my child is able to follow and connect? So this is basically where we talk about two things. One, mental wellness. How do we introduce this whole concept into a child's mind? Because this wellness is something that we need to experience. It is always a very individual thing, right? And when it comes to mental hygiene, this is something for us to constantly start using, because we have to maintain our own hygiene. So when it comes to mental hygiene, no amount of constant, parents monitoring, telling their little kids or their teenagers or even young adults. In our Indian society, we parents don't even stop telling our kids even when they have grown up to become young adults. Why is it that they need to develop their own awareness of their own mental hygiene? This is so important because when we tell as parents, when we suggest, when we start advising, then basically it is always at a very, very superficial level of understanding. But when the person, the teenager himself or herself is involved in incorporating, then a big difference is this teenager starts experiencing and enjoying the experience. So mental hygiene can also be enjoyed. This is something we try to bring into awareness of a teenager. Well, all participants who are listening today, I will want to say this one thing which I have constantly said in my past 30 years. I have constantly said one thing, that there is no one kind of fit all socks or program when it comes to what should teenagers do and what should parents do. How can we basically make the home a very harmonious one? I'm sure every family is doing an amazing bit. I'm sure every family enjoys their own ways in, involving their own culture, their own ways of bringing about this harmony, their own ways of, the milestones of development in their children is something which every parent is enjoying. But then it is always, let us remember that it is always very specific to each teenager, each individual child that is in question. We cannot talk about something very generic. And hence, today, I think our society is much more, sharper, much more aware, much more aware of so many things. Like, let's not compare our child with another child. All these things is very well known. And today we are talking to a very, smarter group of parents too. Well, our teenagers are even smarter. So where is it and what kind of issues can develop and what kind of hygiene are we discussing? See, one is if there is a problem and how do we actually address the problem? But another thing is that can we constantly harp on, can we constantly discuss about every teenager developing something referred to as mental hygiene? What will it do in future? It is basically just going to support one's lifestyle. It's basically just going to make life more meaningful. So in order to start this, I'm sure everyone must start thinking in the lines of mental health and mental hygiene. Most people, when we start using the word mental itself and mental health, then it's always taken in the negative. It's always thought about, okay, do I have a problem? We've moved a long way, of course, no doubt. We've changed a lot. In fact, today it's no longer said that, am I mad? Why do you want me to take me to a psychologist? These statements have, refreshed and has been reframed several times. Today, we do not have people thinking that, okay, I think I have an issue. While there is also another side, I see a huge group who basically sit down and go to their Google doctor and start believing that they have a whole lot of problems. This also becomes a very, very uncomfortable thing by the time they reach a clinic. So one is about overindulging with their, level of hygiene that they need to start, and the others who completely deny and who completely believe that this is not for me. I don't have an issue. So is it about having an issue? No. It's about developing something which is referred to as a support or the best mechanism for good life. That's what I will say. Teenagers are this group who are, in this stage of transition, right from their physical self to their social self to their emotional self. Everything is in their stage of transition. They've just moved out of this very carefree childhood period, and they've not yet moved into that adulthood period, where again there is another sense of responsibility. But today, if we talk about the society 2023, in fact, since a decade, we will understand that every teenager is given freedom and responsibility. We no longer wait for them to grow up and become adults. Today, the society has moved so much more ahead in times of doing both negative and positive when it comes to this group of teenagers. They're no longer that naive that they can be treated as children. And sometimes they wear, extra large shoes, which is not good for them. So it becomes more painful. The whole journey becomes more painful, trying to feel, behave, and become adults much before their age. So that teenage, that beautiful adolescent period is lost in many of them. That's something that can be a concern in many families. So how do we bridge all this? How do we give them that harmony? It all starts with what kind of readiness do parents have? Have we ever thought of this? We are talking about, at one side, we are talking about the stress that these teenagers experience. There's a whole lot of it today. There is this pressure of academics. There is this pressure of our society for many, many, many reasons. In fact, the more we are evolving, the more we are developing, we have started believing that we need to induce this amount of pressure. But trust me, that's not it. Trust me, we need to actually start developing a better lifestyle where we do not need to live under such pressure. So how can it be done? It requires some amount of mentoring. In this fast-paced world, the way we are running from morning till night, we are just shifting our roles from probably by the hour. Say this is also happening to teenagers. Everything was online for one small stint of maybe 2.5 years, but now again everything is back to square one. Everybody is rushing, doing 10 different things, 10 different courses, 10 different programs. All this is fair enough if we are able to understand that we have the ability to sustain, but not at the cost of our mental hygiene, is what I would want to reaffirm. So when I was talking about the parents' readiness, let me go back there, because yes, when we are talking about the stress in teenagers, most of us parents have started trying to understand, started trying to tell our teenagers, our children, that, it's okay. Don't get into this pressure. And very nice, these days parents tell that it's okay, we are not even concerned about your marks when it comes to academics. They're encouraged to go out and do whatever they like because of peer pressure. My friend is going there, can I also go? Where do we draw the line? This is very specific to family. See, where did all this planning start? Planning started right before our child was born. You'll all agree with me, dear parents, all who are here now in this forum, you'll agree with me that every parent makes a certain kind of a planning. See, in the womb, today, the medical world, people like Dr. Vasudha, everyone, in this world of Ayurveda, in fact, there is nectar, Amrita is there, which is provided to every mother. And we are doing our bit in order to see that there is some kind of a physiological grooming, that grooming is happening within the womb. So our child is developing well, developing in the normal milestones of growth, intellectually growing sharper. We have so many remedies for it, thanks to the world of medicine. How many of us have realized that we need to also prepare ourselves and prepare this little one right from the womb to develop emotionally? And that is so important, to have this mental health and hygiene. It's so important that these children can definitely feel more grounded, more in control of their own emotions. Anywhere I get an opportunity, I constantly talk about, can we learn the art of controlling or being in control of our emotions? It's a lie if anybody says that, no, I don't get angry, right? So it's not about we should not get angry. Being angry is wrong. It's not at all that way. So being in control of emotions is just all about this mental hygiene that I was trying to indicate. So this readiness comes from parents. And how do we plan this child's upbringing? And then probably we have a lot of financial and other security measures to see that our child is being well taken care of. When it comes to diet, even there, mothers and fathers have become so aware of what to give and how to take care of the child. Where and how does this mental health and hygiene get neglected? So is it taken for granted? Do we sometimes throw our emotions all over the place just because of our own busy routine? We'll have to find out, and we'll have to check that. It's all about, can we just get the harmony back into our homes? This is the first, and trust me, the only place where the whole testing, training, and everything related to emotional sense of control happens for our teenager to go out and face the world. So it could be a fast-paced society. No worries, our teenagers can definitely be able to face it. Well, I'll still look for questions if that will probably make more sense for me to answer them and maybe make it more meaningful.
Yeah, thank you, Dr. Geeta. So I think what you exactly told, is very, very crucial. So being in control of our emotions, and yoga talks a lot about this. We talk about emotional culture, and we have a lot of practices which also bring in this emotional culturing within ourselves. So people have to really understand how this can be adapted and what all is first of all available. Many a times, they think that it's just a counseling is an option or just yoga is an option. May not be. It is a very holistic combination of the available interventions which can probably give us long-term solutions as well. And the point you made, which talks about the small thread, which is especially in a house where the teenagers, we see this. And presently I have a teenager at home and I'm experiencing a lot of things which I used to hear. So my son is almost 15, but what happens is this obviously teaches a lot. I think one thing it teaches is it also teaches us to get a lot of patience within ourselves, because if we lose our calm, and I think it is very, very easy to see that impatience in probably 2x in our child who is the teenager at home. So here, when we look at these changes in emotions, we also know that there is some inherent physiological change which the boy or the girl is undergoing. So, would you like to highlight and say why are they really vulnerable for this psychological stress?
Yes. So like I was talking about this period of transition, now this transition basically is happening in every structure, right from the brain to our physiology. This change in the physiology, the hormonal changes, essentially does play and influence the emotional mechanism too. Since they're all interconnected, what we need to do is we need to sharpen their intellectual capacity in terms of emotions, because there is an emotional intelligence. We need to sharpen their social capacity in terms of tracking their social intelligence, getting them to the right perspective of what could be best for them in terms of social intelligence. Similarly, apart from emotional and social, similarly, even their physical self, when we are talking about those physiological changes, this is the time when they need to have clarity in terms of even spiritual intelligence. This is the time when we need to not just include, but introduce it to them in the manner which is convincing for them to buy. And whatever they have bought, because they are convinced, they need to start using, applying, and seeing how it is taking them forward. So one is that they need to experience what they are learning. They need to experience this. Just being aware is not enough. And hence, I will say that during this period of adolescence or these teenagers, what they're experiencing is, during their hormonal changes, they're experiencing a whole lot of shift. And this is the time when they need to develop a habit of one, right from being calm to learning how to develop their various other skills in order to have that competence to live in the society. It's a very individual and a beautiful, slow effort of every teenager during this period. What I will say